Hi everyone, I am Beatrice. In today's video, we'll look at some common gastrointestinal medications. These medications are commonly tested in NCLEX. I'll go ahead and highlight some important points you need to know. If you are new to this channel and you've not subscribed before, please go ahead, hit the subscribe button. Let's begin. The first medication we'll look at is Metoclopramide. The trade name is Reglan. This medication is a dopamine receptor antagonist. Just as the name goes, it blocks the dopamine receptors. These dopamine receptors, they are present in the chemoreceptor trigger zone in the brainstem, particularly the medulla oblongata. And we know that dopamine is a neurotransmitter that controls so many things. It controls vomiting. It also controls your mood, your emotions. So that's why popularly they call dopamine as a feel-good neurotransmitter. The chemoreceptor trigger zone is responsible for controlling vomiting, nausea. So because of that, when it blocks those receptors, it's able to control nausea and vomiting. Because of that, we use it for nausea, it's used for vomiting, and it's also used for gastroparesis. Gastroparesis has to do with delay in stomach emptying. Now, part of the function of dopamine is also to control movement. So when the receptors are blocked, it is controlling nausea, but at the same time, it's going to affect the patient's ability to move or walk around. And because of that, so the symptoms you want to know for the sake of your exam, you are likely going to see something like extrapyramidal symptoms, particularly tardive dyskinesia. And what this means is when the patient is moving or walking, you see that delay in movement, they find difficult moving or initiating or establishing movement. So they continuously experience repeated movement. Another thing you will see that's so important, watch out for symptoms like continuous smacking of the lips, blinking of the eyes, popping of cheek, facial movement that is uncontrollable. So when you see some of those symptoms and they tell you that the patient is on metoclopramide, you should suspect these extrapyramidal symptoms or extrapyramidal side effect, particularly tardive dyskinesia. It's also important to know that for any patient that is having maybe gastrointestinal bleeding, like gastrointestinal ulcer, duodenal ulcer, peptic ulcer, it's not advisable to give metoclopramide because it's going to worsen that bleeding. And also, it's important in Parkinson's disease. Don't give it to patients with Parkinson's disease or seizure because most times patients with Parkinson's disease may also experience that problem with initiating and coordinating movement. So, and because we know that one of the side effects that can come from metoclopramide is this extrapyramidal symptoms with tardive dyskinesia, inability to control movement. So when you give them metoclopramide, it can worsen that problem. Also, do not give it to patients that are having some seizure disorders. The next medication we need to know is Ondansetron, which is Zofran as trade name. This medication blocks the serotonin receptors, also present in the brain. Serotonin is also present in, apart from the CNS, the brainstem, it's also present even in the GI tract. And it controls mood, it controls emotion, it controls some gastrointestinal activities also. When it blocks that receptor, it's able to control nausea, it's able to control vomiting. So we use it for nausea, vomiting, and also nausea-induced chemotherapy. When patients are going for chemotherapy, at times they begin to experience nausea. So they give Zofran before maybe that procedure, chemotherapy, they give it before that. Now, it's also important you know that Zofran can cause serotonin syndrome. This will happen if the patient is already taking maybe like antidepressant like selective serotonin reuptake inhibitor, what we call SSRI. Now, because the serotonin receptors are blocked, the brain will sense it that the body needs to produce more serotonin. And because the patient is also taking other medication that also inhibits the reuptake of serotonin, it will increase the abundance of serotonin, that serotonin toxicity. And the patient is going to manifest some symptoms that are associated with this serotonin syndrome, like tachycardia, hyperreflexia, even high blood pressure. And because again, serotonin also coordinates the gastrointestinal tract, so the patient may even be experiencing problem with diarrhea, serious diarrhea, and they could be very restless. So some of those symptoms they are associated with serotonin syndrome. So you need to know that. It's also important that this medication can lead to prolonged QT interval on the EKG, so it can affect cardiac rhythm, particularly a deadly ventricular arrhythmia that we call Tosades depointed. So it's important you note this medication can cause this. So in NCLEX, you may see a question that talk about a patient taking Ondansetron and the QR interval is prolonged. What when they ask a question related to that, you can suspect this Tosade depointed. It's a medical emergency. It can cause death if it's not managed. So you need to note that. If you are finding this video helpful and you've not subscribed to this channel, please go ahead, hit the subscribe button, and I also want to see your comments. Now, the next medication you need to know is Lactulose. Lactulose acts as a laxative, so it will increase bowel movement. So it's used to treat constipation. It is also used to treat hepatic encephalopathy. This is a complication of problem with anything that has to do with the liver or bile duct where there's excess accumulation of ammonia in the brain. What happens is that when you give a patient lactulose and the patient is having hepatic encephalopathy, it will bind to that ammonia and promote the excretion through the feces. It's important you know that when they mention a question that has to do with lactulose and they said a patient is having hepatic encephalopathy, the mode of action is going to enhance removal of ammonia. That means there will be decrease in ammonia level. Also, there will be improved mental status. So that's how you know that the lactulose is working. Another thing you as a nurse need to know is about 2 to 3 loose stools per day should be excreted. When the patient has high ammonia, the goal is for the patient to have at least 2 to 3 loose stools per day. Because as the more stool the patient excretes, the more of the ammonia is removed. And now you know the ammonia is working effectively, like I said, the ammonia level is going to decrease when they do some blood work. But the more important is going to be that improved mental status. So when the patient that is having hepatic encephalopathy is comatose, is not responding well, and you see them, their GCS begin to return, they begin to know the mental status get improved, and you know that lactulose is actually working. Now we look at another medication, which is sodium polystyrene sulfonate, what we call K-exolate. So this medication, how you remember, is from that K, potassium. So it helps to remove remove potassium from the body. So it's used for treating hyperkalemia, any condition that causes hyperkalemia where the potassium is very, very high in the body. The normal potassium level is between 3.5 to 5.2. So when potassium is very high, it's above that 5.2, can cause cardiac arrhythmia, can cause death. So it's important you know this medication because NCLEX is a test of safety. You want to know this medication. So the mode of action is it binds to potassium. So it's a potassium binding resin. So it binds to potassium and promote the excretion through feces. So because of this side effect, of course, if it's treating hyperkalemia, it means the potassium may become low if you don't monitor it. So you need to assess for hypokalemia. And sign that the patient may be having hypokalemia could be cardiac arrhythmias also and weakness. You know that potassium, if it is too high, is a problem to the heart. If it is too low, it's also a problem. So you need to watch out for that. So contraindication, bowel obstruction, paralytic ileus, also hypokalemia. If the potassium level is low, you want to hold K-exolate. Now the last one is Sucralfate. The trade name is Carafate. It's a mucosal protectant. So what we mean by mucosal protectant is going to protect the lining of the mucosa of the stomach. So it's not neutralizing or reducing gastric acid production. It's not going to reduce that. It's important you know that the mode of action is just to line that mucosal lining and prevent that acid from constantly, eroding the wound. So when that ulcer on that mucosal lining is protected or coated with sucralfate, it will reduce hydrochloric acid from constantly eroding that ulcer, and that will promote healing. So that's how you know. So it's important you know that. And also, it's important you teach the patient to take this medication on empty stomach, because this medication must be there to first coat that mucosal lining before the patient can eat. So 1 hour before meal is better before the patient take it. So take note of this because these are commonly tested NCLEX questions. When they talk about sucralfate, you need to know the mode of action and what to teach the patient. Also, you should not give this medication with any other medication like antacid or any other medication. As a matter of fact, give an interval of like 2 hours when the patient are taking this medication, because this medication is going to decrease the action of other medication. So that wraps us today's topic on some common gastrointestinal medications. If you find this video helpful, please like, share, and subscribe for more educational videos. Thanks for watching.